I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press the bell icon button. In this second part of congenital infections in newborns, we will discuss about two infections. One is a varicella zoster infection, which is also called as chicken pox. The other one is a Parvo B19 infection. The other names of Parvovirus B19 infections are slapped cheek or fifth disease. Varicella zoster virus infection or chickenpox in mothers can cause congenital varicella zoster syndrome depending on the time of onset of the maternal infection. It occurs when transplacental spread occurs during early fetal development, or varicella zoster virus infection occurs during the delivery or just before the delivery or after the delivery. Approximately 25% of the fetuses of infected mothers will acquire the infection, but only 2% will be clinically affected. When infection occurs within the first 6 to 12 weeks of gestation or pregnancy, limb development can be affected. If fetal infection occurred at 16 to 20 weeks of gestation, so it is usually associated with eye and brain disease. Fetal infection during the third trimester is believed to result in less severe disease. So what are the signs and symptoms of congenital varicella syndrome? The range and severity of associated symptoms and physical findings may vary from case to case depending on when maternal varicella zoster infection occurred during fetal development. In many cases, newborn with this syndrome may be abnormally small and have a low birth weight due to abnormal growth delay. Distinctive skin abnormalities are prominent. For example, thickened skin, overgrown scar tissues, skin may be hardened and red. In these babies, legs and arms are underdeveloped, abnormally shortened, or incomplete development of finger and toes. Brain abnormalities are very common. For example, degeneration of upper portion of the brain, that is called as cortical atrophy, abnormal enlargement of outer portion of brain, abnormal smallness of head, that is called as microcephaly. Mental retardation is another important feature, and these patients suffer with learning disabilities. In eye, cataract is very common, and also abnormal or smallness of one eye or both. So this is called as microphthalmia. We also see rapid eye movement, side to side movement in these patients. So how varicella zoster syndrome is diagnosed in newborns? So first of all, of course, there would be documented history of chicken pox in mother during the pregnancy. Then PCR, polymerase chain reaction, another that is a molecular method. So that is done on the vesicle. So vesical fluid is taken and sent to the virology lab. So PCR is done on that vesical fluid. So PCR detects DNA of varicella zoster virus. Some serology tests are also done. So in serology test, so immunoglobulin G and immunoglobulin M are checked whether they are detectable or not detectable. So treatment is primarily based on two things. The first of all, if mother suffers with chickenpox, specifically during the first 20 weeks of pregnancy, then immunoglobulins are offered, or acyclovir, which is an antiviral agent, that is also offered to prevent the disease, or if patient develops the disease, then disease will be mild. If the mother develops chickenpox within the last few days of her pregnancy, the risk of neonatal varicella is very high. The mortality of this condition can be as high as 30%. In that case, varicella zoster virus immunoglobulins are used, and if the child develops chickenpox, then the child is managed by a specialist doctor and antiviral treatment is given. Now we talk about Parvovirus B19 infection during the pregnancy and the syndrome. Parvovirus B19 infection in adults is usually asymptomatic, and in most of the cases it goes unnoticed, undetected. Parvovirus B19 infection during the second trimester can be associated with hydrops fetalis and fetal loss. If the fetus does not develop any of these acute complications, or if intrauterine blood transfusion is successful in saving the fetus, then the risk of chronic parvovirus B19 infection in the fetus is negligible. So this condition is managed by a specialist doctor. So they do blood testing on monthly basis to check whether the fetus is developing hydrops fetalis or are there any chances of fetal loss. So they manage appropriately and accordingly. Thank you very much for watching this video. So I will talk about other viral infections, for example cytomegalovirus, in the third vlog or third video. Thank you very much.